Common sexually transmitted diseases. An STD or sexually transmitted diseases, also known as an STI or sexually transmitted infection, is an infection that is spread primarily through sexual contact, including vaginal, oral, and anal intercourse. STDs are caused by various bacteria, viruses, and parasites that can infect the genitals, mouth, rectum, or throat. Sexual health is essential for overall well-being, involving the prevention of STIs and unplanned pregnancies, enhancing relationships, and supporting mental and emotional health. Regular testing is crucial for early detection and treatment of asymptomatic infections, preventing the spread of STIs, providing peace of mind, protecting fertility, and benefiting public health. Overall, promoting safe sexual practices and regular testing is vital for individual and community health. Chlamydia. Chlamydia is a common sexually transmitted disease caused by bacteria Chlamydia trachomatis. Chlamydia often does not cause any symptoms, making it challenging to detect without testing. However, when symptoms do occur, they can include pain or burning during urination, abnormal vaginal discharge with a strong smell, pain during sex, lower abdominal belly pain, bleeding between periods, pus or watery, milky discharge from the penis, swollen or tender testicles, pain, discharge, and bleeding around the anus, redness, pain, and discharge in the eyes if infected, and sore throat in rare cases. If left untreated, it could lead to serious complications such as pelvic inflammatory disease in women, which can cause long-term pelvic pain, infertility, and ectopic pregnancy. And many can lead to epididymitis, causing pain, fever, and potentially infertility. Additionally, chlamydia can increase the risk of reactive arthritis and can be transmitted to newborns during childbirth, leading to eye infections and pneumonia. Gonorrhea. Gonorrhea is caused by bacteria Neisseria gonorrhoeae. Gonorrhea can be asymptomatic in many cases, especially in females. When symptoms do occur, they can vary based on reproductive anatomy of the infected individual. For females, they will experience unusual vaginal discharge, thin, watery, green, or yellow, pain or burning sensation during urination, pain or tenderness in the lower abdominal area, and bleeding between periods or after sex. For males, they will experience unusual discharge from the penis, either white, yellow, or green, pain or burning sensation during urination. However, they differ with the female reproductive organ because they will experience inflammation or swelling of the foreskin, pain or tenderness in the testicles, rare. Gonorrhea can also affect other areas, the rectum, throat, or the eyes through unprotected oral or anal intercourse. Symptoms in the rectum may include anal itching, discharge, and pain during bowel movement. In the eyes, symptoms can include eye pain, sensitivity to light, and pus-like discharge. Throat infections may present as a sore throat and swollen lymph nodes. Trichomoniasis. Trichomoniasis is caused by a parasite called Trichomonas vaginalis. Trichomoniasis can be asymptomatic in many cases, especially in men, making it challenging to detect without testing. When symptoms do occur, they can also vary between men and women. Women experience a large amount of thin, often foul-smelling vaginal discharge that can be clear, gray, white, gray, yellow, or green. Genital redness, burning, and itching, pain with urination or sex, discomfort in the lower stomach area, vaginal spotting or bleeding, frequent urge to urinate. For men, they will experience discharge from the urethra or penis, itching or irritation inside the penis, burning during urination or after ejaculation, frequent urge to urinate, pain when urinating or having sex. Trichomoniasis can lead to complications if left untreated, such as preterm birth, low birth weight in newborns, and an increased risk of acquiring or transmitting other STIs, including HIV. HIV or AIDS. HIV or human immunodeficiency virus is a virus that attacks the immune system, weakening the body's ability to fight infections and diseases. AIDS or acquired immune deficiency syndrome is the late stage of HIV infection when the immune system is severely damaged, leading to life-threatening illnesses and infections. The symptoms of this type of STD occur in three stages. Stage 1, acute HIV infection. Within 2 to 4 weeks of HIV infection, flu-like symptoms may occur, including fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. Symptoms can last from a few days to several weeks, but some individuals may not experience any symptoms during this stage. Stage 2, chronic or asymptomatic HIV infection. After acute stage, HIV may not cause any symptoms for many years, although the virus continues to damage the immune system. Now on the last stage, we mentioned this earlier. Stage 3, AIDS. Infected individuals who experience rapid weight loss, recurring fever, extreme fatigue, prolonged swelling of lymph nodes, diarrhea, sores in the mouth, anus, and genitals, pneumonia, skin blotches, memory loss, depression, and other neurological disorders. Testing and treatment. STD testing is crucial as it could detect the disease early since many STDs are asymptomatic but can cause serious health issues if left untreated. Regular testing helps identify these infections early. If ever you contracted the disease, it allows you to take steps to preventing transmitting STDs to others, such as practicing safe sex or informing partners. Early treatment of STDs can prevent complications like infertility, chronic pain, and severe health problems. And widespread testing helps track infection rates, manage outbreaks, and inform public health strategies. Testing gonorrhea and chlamydia involves looking for signs of bacteria in the fluid samples from the urethra, cervix, vagina, throat, rectum, or urine. It is recommended for sexually active individuals, especially women under 25 and men who have sex with men, to be tested annually. HIV testing involves different types of tests, including antibody tests, combination of antigen antibody tests, and nucleic acid tests or NAT. Rapid tests can provide results in as little as 5 minutes, while at home tests like OraQuick offer convenience or privacy. Trichomoniasis can be treated and tested usually looks for a parasite in a sample of a body fluid swab from the infected area, which is typically in the vagina in women and in the urethra in men. Gonorrhea and chlamydia are bacterial infections, thus they can be treated with antibiotics. Early treatment can cure these infections and prevent complications. For viral infections like HIV, it can be managed with antiretroviral therapy or ART, avoiding the progress to AIDS, improving immune function, and reducing the risk of transmitting the virus to others. Trichomoniasis treatment typically includes antibiotics like metronidazole or chitinidazole to cure the infection effectively, essentially for sexual partners to be treated simultaneously to prevent reinfection. If ever diagnosed with an STD, it is important to complete the full course of prescribed medication even if the symptoms disappear. Notify sexual partners so that they can get tested and treated if necessary. Avoid sexual contact until the treatment is completed and healthcare provider confirms the infection is cleared. get retested after completing treatment to ensure the infection is cured, especially for bacterial STDs. To prevent spreading or contracting STDs, it is encouraged to use protection. Condoms can reduce the risk if used consistently and correctly. Regular testing for STDs is crucial, especially for sexually active individuals with those with multiple partners. Vaccines are available for some STDs such as HPV and hepatitis B. Lastly, being in a mutual monogamous relationship with an uninfected partner reduces the risk of STDs. Comprehending and handling common sexually transmitted diseases is a vital part in the health maintenance process. Frequent testing is crucial for early diagnosis and treatment that will minimize the severity of related health conditions and destruction of the pathogens. Using condoms and getting immunized are safe sex practices that scientifically reduce the risk of contracting STDs. It is imperative that people who are sexually active to take tests for sexually transmitted diseases on a regular basis and have frank conversation with their partners about their sexual health. Keeping informed and adopting safe practices along with prompt medical attention can help us protect ourselves as well as our communities from adverse effects of STDs. Remember, taking charge of your sexual health is a key component of a healthy, fulfilling life.